What happens when you have a herniated disc and the herniated disc is actually causing your pain? Now, we do have to clarify that we can only prove or identify that the disc is the cause of your pain, not via MRI. The MRI will say that there's a herniated disc, but in order for us to determine if that disc is actually causing your pain, we have to identify it clinically, how your body is moving. So here is our spine. We have our front, we have our back, and we also have our spinal cord and the nerves that actually exit out the openings of the spine. Oftentimes you'll hear a herniated disc, and that means that there's going to be a lot of pressure in the front causing pressure to cause that disc to truly bulge to press on the nerve, producing pain. Again, this is only going to be confirmed clinically in regards to how your pain is behaving. And so what that means is, if in the event that there is in fact a bulge, as you can see, there's a lot of round or a little bit or enough rounding to push all the contents backwards. Theoretically speaking, if your disc is the cause of pain, it would actually get worse with forward bending and rounding, but also improve when we get a little bit more neutral, and if we need to, extend a little bit more to push the contents of that disc back in towards the middle of the disc, giving you an opportunity to take the pressure off the nerve. And what that also tells us is that we need to minimize the opportunities of having that rounding forward, because we know rounding forward the spine is going to cause a lot of issues. So what does that mean? We have to be able to focus on hinging at our hips. That means that the hip crease increases as we're moving, especially when trying to bend forward, and minimizing the opportunities to round or hunch forward. So if that's the case, if you are presenting clinically, again, it gets worse with forward bending. It gets better with returning back to neutral, or even what we call centralizing your pain. Then we want to minimize those opportunities to round forward.